In terms of prescribing medications, especially in complex situations like PH and PAH, we have never required a specific specialist, such as a cardiologist or a rheumatologist, to make that diagnosis or to write that prescription. Nowadays, we realize that with the conglomeration of more and more healthcare professionals into health systems, we're seeing a lot more multidimensional, multifactorial, and multidimensional teams, and we're, in many respects, getting away from a lot of the siloed approaches to care that we used to have, where only cardiologists would see this group of patients and only rheumatologists would see that group. Especially, this goes along with the fact that so many of these conditions are now understood to be crossing many different organ systems and many different specialties in terms of their physiology and in terms of the multidimensional approach that needs to be taken to treatment. So ultimately, what we want to do is make sure that all of our members are plugged into the right systems of care where they can get access to the expertise they need, and that would include the ability, once they've had the specialist's insight and plan development, if necessary and if available, to go back to their communities and have their care continued by community physicians in collaboration with those specialists that are typically at the academic or tertiary care center. At Humana, we've developed a very sophisticated system to help patients get to the care that they need, especially for something as complex and sophisticated as PH and PAH care. We have a very large team of care coordinators, most of whom are healthcare professionals, either nurses or social workers, other people who are very experienced in this. Their job is to identify members who are at risk for chronic complex conditions. We use a very well-developed predictive model to do that. And then we assign a score to each of those members, which is refreshed on a monthly basis as we get new data from medical or pharmacy data or other sources. And then the nurses outreach to these members to do an assessment, understand where they are in their condition and what help they need. The care coordination that those nurses provide is really critical. It focuses on member education, which is tremendously important because it's very important for everyone in healthcare to understand that for the people in the community, the level of health literacy is quite problematic. And so whereas we on this side of the table understand the terminology and the concepts we're delivering to patients, they may not understand that, and they may not really be able to take that information and use it in a way that will help them participate fully with the healthcare professional team. We also are becoming more and more aware in the last few years, and this is an area that Humana has done a lot of work, of the importance of social determinants of health. The very important concept that there's so many things that impact healthcare, the delivery of healthcare, the outcomes in healthcare that really have not been part of what we've traditionally thought of as medical care. Things such as transportation. If someone can't get to the hospital or get to the PAH treatment center, it really doesn't matter how good those physicians are because that person can never take advantage of that. If people are concerned about housing, if they're concerned about where their next meal is coming from, if they're concerned about their children not living in a safe community, again, all of those issues tend to push a person's focus on medical care way down the list and lead to a lot of the issues with compliance and adherence that physicians have always been aware of but never really understood how to address. We also want to be very focused on the fact that even people with insurance are going to have very significant challenges in terms of covering the cost of medical care, especially when you look at the very significant out-of-pocket costs that many people have. So benefit coordination, helping people deal with the claims they receive, making sure that they're accessing all of the resources in as efficient and low-cost way as possible, those are all very, very important components in making sure that people not only get the care, but also are being as compliant and as adherent as possible. And then we have a very large group of pharmacists who reach out to members who are on these expensive, complex specialty drugs on a monthly basis to make sure that they understand how to take the drugs, that they're addressing any potential issues, providing any support that members might need, and also making sure that the delivery of these drugs is going to be safe and timely so that the members have the drugs that they need. For a complex condition like PAH or PH, it's really critical to make sure that we are coordinating pharmacy services, especially when members are receiving their drugs perhaps from multiple different sources. One of the advantages that we have at Humana is that we own our own PBM, so we have visibility over both the medical and pharmacy benefit as opposed to a health plan that might have an external pharmacy benefit manager or PBM where the plan can see the medical side but has to go through an outside third party to see the pharmacy side, the self-administered side. One of the things that we do with our vast data resources and our very large networks is we make sure that we're understanding where are members receiving their medications, even if they're not through us. How do we coordinate that, again, through the pharmacists outreaching to members on a monthly basis to ask about compliance, issues they have, addressing any educational concerns, accessing any other resources that they might need, such as testing or monitoring, and also making sure that all of the medications they're receiving are going to be delivered in a safe and timely way.